told you need a colposcopy after you've had your recent cervical screening letter, you're probably feeling a mixture of emotions. You could be a bit anxious, totally understandable, or confused, but you're not alone. I'm Brooke, I'm a gynecology doctor working in the NHS, and in this video I'm going to walk you through exactly what colposcopy is, why you've been invited, and what you can expect before, during and after your appointment, and we'll also break down what your screening results actually mean, because those letters can be really confusing. So let's take a deep breath and let's get into it. First things first, understanding what your screening result means. Yes, smear tests have changed, and this means that your result letters could look a little different. So the actual cervical screening, also known as a smear test, process will be the same for you, but it's how the lab processes the samples that's different. So what does that mean? Well, cervical screening now checks first for high-risk types of HPV, and that's the virus that causes 99.7% of all cervical cancers. And if that's present, only if that's present, they might go on to look at the cells in more detail. Now, most of us will get HPV at some point in our lives. It's super common, there's different types, and it's passed on through skin-to-skin contact or during sex. And in the majority of people, it clears up on its own without causing any harm. But in some cases, HPV sticks around longer than it should, and when that happens, it can start to cause changes in the cells of the cervix over time. So, your results letters might say, firstly, HPV negative. Great news, there's no high-risk HPV found, so you'll usually be invited back for your screening at the regular intervals. It might be 3 years or 5 years, depending on where you live and how old you are. Next, it might say HPV positive, no abnormal cells. And this means that they saw the virus was present, they took a closer look at the cells from the cervix, but they were all normal. And this means you might be invited to come back for another cervical screening in about 12 months' time, but usually your immune system will clear the virus by then. Next, it could say HPV positive with abnormal cells. And that's a situation where you might be invited for a colposcopy where we can take a closer look at the cells of your cervix. Or the result letter could say unsatisfactory sample, doesn't mean anything's wrong, it just might not have been enough of a sample to take a closer look and to give you an answer, so it probably needs to be repeated. So what is a colposcopy? Why are you being invited? Well, if you went for your cervical screening, your smear test, and you've now had a letter saying you need a colposcopy, it probably means that your HPV, human papillomavirus, result was positive, and then there were some changes found in the cells of your cervix. So what does it mean? A colposcopy means having a closer look at your cervix using a special camera called a colposcope. The camera doesn't actually enter your vagina. The doctor or the nurse specialist keeps it outside of the body, but uses it to zoom in on the cervix. Now, being invited for colposcopy doesn't mean that you have cancer. Most people who go for colposcopy don't have any problems, but it's about checking if there are any changes in the cells of the cervix, how significant those changes are, and whether or not you need any treatment for them. So what's going to happen at the appointment? Well, here is how it usually goes. You'll be seen in a hospital outpatient clinic. So it's not surgery, you're not going to need to stay overnight, you're coming to a clinic. You'll be shown into a private room and asked to undress from your waist down, and then you lie back on a couch with your legs supported up. A speculum, which is like the one that was used during your cervical screening, is gently inserted into the vagina so that the nurse or the doctor can identify and hold your cervix. They'll usually aim to hold it just with the speculum alone, and then they'll use the colposcope to have a really close look at your cervix. The colposcope never touches you, it just zooms in. They might apply a liquid to highlight any areas of concern on the cervix. You might feel a little bit of stinging, but it shouldn't be painful. Now, if they do spot any abnormal cells, they might take a tiny sample, a biopsy, which can pinch a little, but it's usually very quick. And you should be able to go home right after the procedure and you'll get your results in a few weeks. The whole thing usually takes about 15 to 30 minutes. But does it hurt? Well, most people say that it's uncomfortable rather than painful, kind of like a smear test, but a little bit longer and potentially with an extra quick test. You might feel a pinch or a stinging sensation if a biopsy is taken. And if you're worried about how that might feel, you should discuss your pain relief options with the team before your procedure. And if you're nervous, it's completely normal. Let the nurse or doctor know. They're there to help to support you so that you can be as relaxed as possible. So what happens next? Well, there's a few different possible outcomes. Firstly, it might be that everything looks normal. You'll probably be told right away that no treatment was needed and you can go back to routine screening. You might have some mild changes. So if a biopsy is taken, it can take some time to come back, possibly a few weeks. But if this is later shown to be CIN1, you may just be monitored with more frequent screening to see if things progress or they go back to normal on their own. If you have moderate or severe changes, such as CIN2 or CIN3 on your biopsy result, it means you might be offered treatment to remove those abnormal cells before they turn into anything else more serious. And this is usually done with a simple procedure called a LETS, which is a large loop excision of the transformation zone. Rarely, they might find something more serious, such as early changes of cervical cancer. And if that happens, your healthcare team will talk you through exactly the next steps that are required in any further treatment. Common questions I get asked. Firstly, can you drive home afterwards? Yes, unless you've had any treatment under general anaesthetic, in which case they'll advise you. Will you bleed after you have a biopsy? Well, you might get a bit of spotting or brown discharge for a few days. You should just wear a pad. We don't recommend having any tampons inside if you've had any internal procedures. You should also avoid sex or swimming until that bleeding settles down. Do you need to bring someone with you to the appointment? You absolutely can if it makes you feel more comfortable, but it's not essential. I want you to remember you're not alone. Around 1 in 20 screening results show abnormal cells, recommending colposcopy. So a lot of people go through this, it is common. And going to the appointment is a really positive step. It means your healthcare team is being proactive, they're spotting and managing any changes before they become something more serious like cancer. But if you're worried, it is okay to ask questions. Write them down, take them with you, and don't be afraid to speak up if you feel unsure, if you're worried about anything like pain, for example. So that's it, that's what happens in a colposcopy. I really hope this video has made it feel a little less intimidating and more understandable. So if you've got any more questions, pop them in the comments below. I hope your appointment goes well and let us know how you get on.